Hello, Facebook Live. This is Bill Burr, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. Thank you for joining us for this broadcast. Format we're going to use today is similar to what we've been doing, and that is I'll be talking about some things related to COVID and the pandemic, and then we're going to have a guest on with us, and then we're going to do a field trip. And today, when I get done with my COVID stuff, we're going to be talking wounds in our wound center, and so. Um, Yeah, I think you'll find that interesting. It's a world that most of us just aren't aware of. But before we get into that, and I get a chance to introduce my guest, I do want to talk a little bit about COVID, and as always, encourage you to, as I'm talking, to send out your questions. So let's talk right now. It seems to me like the hottest topic is the vaccine situation. So let me. By the way, we had a couple of listeners who've already sent in questions, and we can put those on the screen, and then I can answer those to start with. Or I think we can. Okay, while we're waiting for those to go up on the screen, because I don't exactly remember them, let me talk a little bit. Oh, here we go. If someone has been vaccinated and then has been around someone who has COVID, can they be a carrier? The one who's been vaccinated, that is. Um, yes. So here's the question, and here's my answer to that. Throw that up one more time. Has been vaccinated and has been around someone who has COVID. Yes. Okay. So here's the deal on that. Uh, as a lot of this stuff, we don't know for sure. But in theory, someone who has been vaccinated, who is around someone who has COVID, could still get some of those viral particles in their mucous membranes, whether that be their nose, mouth, that type of situation. And because my understanding, at least of the vaccine, is that it produces antibodies that once those viral particles get into your bloodstream and stuff, that they're inactivated. There's, in theory, uh, you could be vaccinated and be in good shape yourself, but have some of those particles that could hang out in your mucous membranes of your respiratory tree that, as you're coughing, sneezing, whatever, you could give to someone else. Which is why, at least for now, if even though you've been vaccinated, if you get exposed to someone, you still have to do the same quarantine process as you did before you were vaccinated. And if you're vaccinated, we're still required to wear a mask and to social distance because we just don't know for sure on that question. And we're erring on the side of caution for those individuals who've been vaccinated. The risk is low, but it is still there. And until we have more information, more science behind this. Remember that even those folks who, the earliest vaccinated folks, a big group of people that were vaccinated, was a little more than a month ago. So it's going to take some time to figure. That's a good question, but it's going to take some time to get it figured out. There was one other question that, if I remember right, that we wanted to answer. Yeah. If someone has had COVID, not vaccinated at all, can they get COVID again? So the answer to that is yes. It doesn't seem like, at least so far, this pandemic started at least here in the US in, February in New York, if I remember right. Um, we haven't seen much of it. We haven't seen many people who have had COVID and then have gotten it again, but it has happened, which is, once again, why we ask our folks who have had COVID to still follow the masking and the social distancing and those kind of things. And right now, at least, if I remember right, we're at 90 days. So if you've had COVID, we give you like a 90-day pass that we don't think you're going to get infected in those 90 days. Beyond that, it's still up for debate. I'm hearing a little bit that they may be pushing that towards 6 months now in terms of you're not likely to get it. Um, Anyhow, I hope I answered the question as best. I answered as best I can, at least right now. So good question. Does the COVID vaccine have a live virus? No, it does not. It does not have a live virus. These two mRNA ones do not have a live virus, and I'm almost certain that the Johnson and Johnson one, which keep hearing that the FDA is going to that they're going to present the FDA for emergency use authorization. I'm hearing that that's not a live one either. So that's good. That's a good question, and that's a good thing about this particular vaccination. And by the way, most vaccines nowadays are not live. There are very few of them that are live. Okay, so let's keep talking vaccines. Where are we at in our area in terms of vaccinations? Not where we want to be. That is for sure. So here at the hospital, we vaccinated 95 people, community folks last week. We're doing 150. My understanding is tomorrow, another 150 the following week on Friday. And then we're hearing that we may get more vaccine for the following weeks after that. Not like thousands of vaccines, but more. That's and what we're doing right now as far as that goes is yeah, how are we prioritizing? So the decision that we made in terms of trying to be as fair as we possibly can and get it to the arms of the folks that are most at risk is we're just going oldest to youngest. So if you're someone who is signed up through CGH that you want that vaccine, yeah, here we go. Um, and you can sign up on that website there. Then what we're doing is just going oldest to youngest and giving it out that way. We feel that that's um, a yeah our best way that we can think of to try to get it to the people that are highest risk. So like this upcoming week, my understanding is that I think everyone who's getting the vaccine is over the age of 86. So it's obviously we have quite a few folks who see us who are that age category. And then, boy, I sure hope that this becomes not an issue soon, though, where we have enough of these vaccines that anyone who wants it can get it. But that's where we're at right now. And how it works right now is the health department receives. My understanding is the health department receives the vaccine from the state, and then they distribute it. So the health department is also giving vaccines, and they have their own process for how they're going about doing that. And you can go to the website for the health department. I know they have a link that you can sign on to if you're interested in getting information about their vaccination process. So yeah, the health department is involved. Obviously they're the ones that are calling the shots here, and they're doing the best that they can do given a limited supply as well. Did I answer that limited supply question? Was there another part to that, Matt? Yeah. So yeah, I think I answered that second part, in that yes, the health department is kind of keeping us posted as best they can about how much vaccine is coming their way and how much they're then able to dispense to us to give to folks. So, okay, so Diana's asking if someone has had COVID, are they still contagious and for how long? So, what we do right now is that if you're positive with COVID, you have a 10-day isolation period, and after those 10 days, you're able to go back to work and do your normal stuff, assuming that your symptoms are much better and you don't have a fever and those kind of things. So um, that's kind of the what we're saying. The viral load when you get COVID, it appears as though it's its highest a little bit before you get symptomatic, and then a week or so after, and then up to 10 days. So that's why the 10-day number in terms of infectivity for people who have COVID. Boy, a lot of good questions. If somebody has had COVID, how long are they free from catching it again, and should they get the vaccine? So, if you've had COVID, we know right now the recommendations is 90 days that I recall that you are not very likely at all to get the infection. Not that you couldn't, but it's really really unlikely. I'm hearing that they may extend that to 6 months. I don't think that that's official party line yet, though. And then, what was the second part of that question? I'm not doing good on the second parts here today. Um, And should they get the vaccine? I would get the vaccine even if I've had COVID, just because the opportunity to continue to stimulate your immune response even further is there with the vaccine. So yes, I would go ahead and get that vaccine, at least of what I know right now of the actual infection itself in the vaccine. Good questions. So, and then as far as CGH goes, we're giving out the vaccine, like I said, oldest to youngest, and I think anybody who's in our database right now has received information who is in that category of 65 years of age and older has received information that they're welcome to get onto our list. And so I'd encourage you to do that. And our folks just put the information up about that, how to get on the website list. I know I've been seeing some patients up in our Mount Carroll office for the last couple months covering someone's maternity leave. And when I was in my office in between patients, I know the receptionist took a lot of phone calls about people interested in that list. So I know that folks are calling offices as well and getting signed up to that list. But it'd be pretty efficient if you get on that website. That would be pretty helpful for us. Okay, let's make sure I have every other things about the vaccine. So here's what I know about the one of the things, of course, that comes up about people as they try to decide about getting the vaccine is how safe is it and those type of things. So the last I was looking at is for the Pfizer vaccine right now, the numbers right now that are coming in terms of people that have a severe reaction, which I would define as anaphylaxis, where your blood pressure drops, you're having trouble breathing, and those type of things. It's 5 people per 1 million that receive the vaccine, about 1 in 200,000, and the Moderna one so far is 2.8 per 1 million people, or 1 in 350,000 people have this anaphylaxis. I am not aware of anyone who has died from the vaccine. Now, I haven't confirmed that, but at least when I was looking through, it looked like most of those folks who were having the anaphylaxis received medical treatment, whether that be a hospitalization or just emergency department visit, and then recovered and went about their business. And the other thing about the folks who have had those reactions, at least I think it was the first million or so of the people that received the Pfizer vaccine, of those people, I think like 81% had some other history of allergic reactions to drugs, food, that type of stuff. They tended to have more of an issue with reactivity to stuff. So I think that's encouraging too. And you balance that with this 1 per 200,000, 1 per 350,000 anaphylaxis with the if you were to look at the rate of death or long-term complications of COVID per, let's say, just the 200,000 people in that in that Pfizer group. If you took 200 people that were unvaccinated in our population and saw how many of them got sick and unfortunately passed away, or got sick and had long-term complications from COVID, obviously it's way higher than 1 per 200,000. So, I've been talking about this every week, and to me, that is another reason why it's very clear that when vaccine becomes available for those listening, and for those who are listening who talk to other people who might be thinking about all this, gosh, it seems like the benefits way outweigh the risks in terms of getting the vaccine. Okay. Pat said she's had both doses with no side effects at all, not even a sore arm. Thanks to CGH for allowing the auxiliary volunteers to receive the vaccine. Yeah, you're welcome, Pat, and I'm glad that's your experience. And our volunteers they're around patients and helping out, so we're glad we were able to do that for them. Debbie, before I get to that question, I'm gonna follow up on Pat's question with one other thing though, and I just want to be transparent with everyone who's listening, and that is, I'm glad that Pat's experience was that she didn't have anything. That is not everyone's situation. I know I was just today. I've been walking around here at the hospital, and I had a sore arm both times. But there are folks here at the hospital. We had our second Moderna shot was given yesterday and today, I think, And I'm talking to some folks who are feeling pretty miserable right now. No, they're like, hey, I'm glad I did it. I'm not. I wouldn't have not done it. But yeah, there's that window of time for some people where they have fevers and body aches and they feel a little tired and those headaches, those type of things. So that is happening, and I'm being transparent about it. Once again, though, you weigh that versus the percentage of people who get sick, and unfortunately, the percentage of people that pass away from COVID. I, I still think it doesn't change my feeling on it that it's still a better deal to get the vaccine than not. But yeah, I mean, there are definitely some folks who are feeling the vaccine, and even not many, but a few folks that were like, I think I'm just going to stay at home today rather than come to work because I just want to make sure I kind of feel better before I come back to work. So being transparent with you all. Okay. So here was the question Debbie had. Is there a separate supply in the country for residents of facilities such as nursing homes or skilled care facilities? Yeah, I would say that there's definitely a pot of vaccine that is designated for those nursing homes, long-term care facilities, and to get it to those residents and staff who work in those facilities. Yes, so that was part of the first group of folks, including healthcare workers who the government wanted to get those vaccines to. Okay, and Anne, how long do you have immunity from the COVID virus after you receive your second injection? I just had a conversation about that today with one of our employees, and we do not know. Think about it. The Even the people that were in the trials of these vaccines were given that vaccine, like, I don't know, September, maybe August. So even those folks are 4 to 6 months into the time that they receive the vaccine. So I think it's going to take some time to sort out how long is this immunity going to last for those of us, for those who get the vaccine. And I think that is definitely a to be determined thing. Will it be several years? Will it be like a flu vaccine where every year the folks who track the flu across the world say we think this is the variant that's going to be more likely, and they'll produce the vaccine for that, and they give those vaccines every year? Just don't know. Good question though. All right, keep sending those questions to. Oh, I know. Oh, Mary. As of right now, does it look like if we get the vaccine and we're protected for 3 months, we will get another vaccine in 3 months again? Okay, let me see that again. Um, yeah, I think it's really unlikely, Mary, that the vaccine is only going to cover us for 3 months. I don't know how long it's going to be, but just this. I'm not a CDC person. I'm not National Institutes of Health person, but I would be really surprised if we're not talking, gosh, 6 months in a minimum, and I wouldn't be surprised at all if we're talking 9 to 12 months of protection once you get this vaccine. Understanding, of course, that there's these new variants that are being looked into and what the rate of coverage is for those. So, yeah, good question. Pat is asking, do they or how long these vaccines will be effective? Will another dose be needed? Yeah, don't know. I just don't know. Good question, Pat. I don't know. I think I've given my best guess, educated guess, if you will. So I wanted to share something else too, just vaccine related, and then we'll get into our wound center stuff. But here's an encouraging thing too. Um, Here's another encouraging thing too. We every day get an update in terms of we have a safety huddle and employees who are testing positive for COVID, and um, I'm sorry, that are getting tested for COVID and are positive. Not many these days, but there are still some. And I was just curious. I asked our employee health nurse about that, and at least for the folks who are fully vaccinated, which at the hospital is around 500 folks. And when I say fully vaccinated, they've had both vaccines and they're 7 days beyond that second vaccination. So far, at least, none of them have acquired symptomatic COVID. That's of 500 people. So that's pretty good. It's just, I know it's a little sliver of information, but it speaks again that I think this vaccine is a pretty good one. And actually, more than pretty good, it's really good and really effective so far in terms of protecting folks. So it's another reason to get that vaccine. Sue's asking, when can someone over 65 without underlying conditions get the vaccine? When can someone over 65 without underlying conditions get the vaccine? So at least here at the hospital right now, what we're doing, Sue, is like I said, we're going from oldest to youngest and offering it to those folks who've signed up on our list. So we're really not. It was too much work to try to figure out who had a condition or not. So it's just age based rather than any condition based from oldest to youngest. Okay, you can keep them coming, but what I'm going to do now is I'm going to bring in Anna Immel. There she is.
Hi, Dr. Bird.
Hi, Anna. Welcome. And Anna is the director and manager of our wound center here at CGH. And it's one of those things that I think folks are going to find really interesting because it's something that, unless you have a wound or know someone with a wound, and it's a small sliver of our population, you just aren't aware of it.
Correct.
Yeah. So I want to fire some questions at you here, Anna. You ready?
Yep.
All right. And then for those of you who are listening, please feel free to continue to send questions to me for Anna, or if you have other COVID questions, we'll try our best to answer those too. So what challenge has COVID and the pandemic posed for your team at the Wound Center, Anna?
So there's been quite a few challenges, actually. One of our biggest ones has been we used to let patients bring back a caregiver. That has been a little bit different. We no longer offer that option unless there are a few reasons. Then we'll look into that. But it's been hard because we have to communicate with these folks. And, reaching out to them after we've talked to the patient and, got the patients okay, and then trying to remember exactly what we told the patient so we can tell their caregiver also. So that's been one of them. Another thing has been, we used to, or we still do, go over to the hospital and we do some inpatient care on patients that have wounds. Some of these patients that have COVID have wounds, and we have not been rounding on them, but instead we've been providing some education to the nurse that's specifically taking care of the patient with COVID. So those are a couple of things.
Yeah, I could see those both being issues. And one of the things I really want folks to hear a little bit about is that when you think of a wound center, at least I before I got more knowledgeable about it, I think in terms of kind of your traditional wounds. And when I think as a doctor, I think about like lower leg wounds, whether you have really, really swollen legs and you get wounds, or you're diabetic and you get a wound on your foot. And yeah, okay, that's one bucket of traditional wounds that you guys take care of. Are there any other wounds that you would consider like your bread and butter that you see a lot of? I know we'll talk about non-traditional wounds in just a second, but any other bread and butter wounds that
so surgical wounds, trauma wounds. We do a lot of diabetic. Diabetic is probably our biggest one. And then venous and arterial type of wounds also.
Okay. Yeah. So arterial is blood going down. Venous is blood going up from your legs, by the way, for folks who are listening. How about some non-traditional, not even wounds, but non-traditional stuff that your team takes care of there at the wound center?
We see all kinds of things. So when I started here, and I'm going to go off track a little bit, but when I started here, I didn't expect to see the kind of things that we see here on a daily basis. And, one day is never the same as the next. So we see a lot of things like bacon grease burns. You would not believe how many people come in with a bacon grease burn, or frostbite from the cold like this. Say they fell outside and they've been outside laying on the ground for a while and they get frostbite. Wow. Or lots of people will get tears in their skin from a dog leash. They put their dog on the leash outside, the dog runs and it tears their skin open on their leg. So just anything you can think of, we have seen it at one time or another. Dog bites, tusk tears from animals, really anything you can think of.
Tusk? Like a tusk of what?
Like a pig tusk.
Okay. Yeah, I guess.
Very interesting things.
Yeah, okay. We're going to talk about this. We're going to do a field trip later on. We'll show some stuff. But the other thing in that field trip, for those who don't have the time to watch that, I think it's interesting too that your team takes care of folks who have some radiation related issues. Can
Yes.
you speak to that a little bit, Anna?
So we put patients in HBO, and like you said, we will you'll
You want to say what HBO is just for folks?
hyperbaric oxygen therapy.
Okay.
So essentially, I'll give you the short rundown. What we do is we put patients into a chamber. It uses two things. It uses 100% oxygen and pressure. And what it does is it essentially pushes blood flow to the farthest part of their capillaries. And Dr. Bird, you can speak to that more if you want to. But essentially what it does is it helps tissue that has been damaged. And it helps to heal that tissue in, it's like an adjunctive therapy along with their regular wound care that they would see here.
Yeah. Yeah. So people that have had like radiation to their jaw
Yep.
or their neck that's affected their jaw, or I'm guessing some like breast kind of radiation to your prostate that affects your bladder or your colon, all those kind of things are things that are what I wouldn't consider truly wounds, but are diseased tissue.
Right.
Really, your center's name could be wounds and diseased tissue, or
Yes.
something along those lines.
Correct.
Yeah,
It's kind of a service that we offer that a lot of people don't know about, just because you don't think about it or know about it unless you need it.
Right. And even if you need it, you don't always know that you have it. So
No.
that's why we're doing this, just to help folks understand that. Mary Ann is mentioning her husband was treated. I brought him home from the nursing home for bed sores. I'm glad to hear that. So speaking of, I'm glad to hear that, Mary Ann. That's great news.
That is wonderful.
So speaking of that, I had this in one of my other questions. Can you talk a little bit how successful is your team in trying to heal up some of these wounds, Anna?
So we have a few metrics that we follow up on. One of them is our comprehensive healing rate. So the average comprehensive healing rate, I think, is somewhere around 71% nationally, and right now we're at 79.98%. So well above the average.
Okay. Yeah, and you see the worst of the worst wounds. When we say basically 80% for your team compared to 70% across the nation,
that's a lot.
That's a lot of folks. That's 4 or 5 that are getting better, and these are not easy wounds that your team sees.
No, and a lot of them are patients that chronically live with this. It's not just a one-off.
Yeah. We actually, and you just another thing that I think is interesting for folks to hear. So you just threw out national numbers of 71% versus our center 79.9%, or whatever you said, in terms of wound healing. We have that information because we partner with a company called Healogics. I think that's the name of the company these days.
Yep, it is.
That basically does wound centers across the country, and then we work with them to help give us guidance on our wound center.
Yep.
Can you talk a little bit about that and some advantages that is for our patients here who come to
Yes. So Healogics provides us day-to-day management. They have clinical practice guidelines that we follow. They are the gold standard for wound care management. We do rely on them quite a bit. I know I reach out to them daily with questions and answers and things of that nature. They provide a lot of support to us, and then they also have a lot of research that they've done that we can fall back on. If we have a patient that we're just not sure on, we reach out to them a lot, and they provide us with a lot of great information.
Yeah, it's really what I like about them, and I've been involved with the wound center off and on through the years. Is that you really can see how the center compares to other centers.
Very much so.
In their database.
Yes.
And you get a sense of how you're doing.
Yeah. And if I have a question on anything, I can reach out to them and say, hey, how do we compare to another center that's equal or comparable to our size? And they can give me all the information I need.
Yeah. Let's talk about that, Anna. How are we doing?
We're doing really well. One of the things that I like to focus on is our patient satisfaction. Our patient satisfaction for 2020 was 95.84%. So in my opinion, that's very good. We could always strive for 100%, but I feel like 95 is wonderful. I do review all of our surveys, and we speak to the team about it, and we go through those type of things so that we can better ourselves all the time.
Yeah, and that 95%, I'm assuming, is probably pretty good compared to the database that Healogics keeps.
Yeah, so I'm pulling it up on my screen on the other side. I think it's somewhere around 89% to 92%.
Okay, yeah. So you guys, and there are there are, we call centers of, I think, excellence or distinction or something like that you can get as a center for Healogics, which basically based upon how you're doing with the national database, tells your team whether you get in the ward or not.
Yes. So
How are we doing with that, Anna?
we're doing really good. So we have had the Center of Distinction for a number of years consecutively. We did get it again in 2020. So the Center of Distinction is based on a few things. It's based on our healing rate, our median days to heal patients, which we are currently at 14, which is wonderful.
That is.
I think 21 is pretty much the average. Patient satisfaction, which I already talked about, and then our patient outliers. So we like to keep our patient outliers below 16%.
Okay, that is really good. That's good to hear. And that puts us in what percentile of folks across the country?
That's a good question. I think that puts us somewhere in the top 10%.
Okay, I thought it did. I thought it was something like that. So just for folks who are listening, can hear that. I mean, we have top really good wound care here at CGH in our community because of our wound center. So I just wanted folks to make sure they heard that, particularly for the data folks out there. We have really good data at our wound center.
Yes.
Yeah, thanks. Okay. I also want to just kind of touch on the fact that we have a lot of engagement from our medical staff at the wound center too. Can you talk a little bit about, I think some viewers who are pretty faithful ones have seen Dr. McGlone on this Facebook Live broadcast in the past, and Dr. McGlone is the medical director at the wound center. In addition to Dr. McGlone, we have pretty good engagement. We have very good engagement of other medical staff. Do you want to talk about that a little bit, Anna?
Yeah. So we have 6 providers at the wound center. Dr. McGlone, obviously. We have Dr. Kennedy, Dr. Riley, Dr. Wakefield, Teresa Kruger, and then Dr. O'Halloran. So our specialties range from surgical specialties to podiatry, and then Teresa also does internal medicine in addition to wound care.
Okay. Yeah, it's a good thing. And then it's the other thing about this is that these folks have had some specialized training in addition to the usual medical training to take care of the wounds at the wound center, which I think is why your team does so well too.
Yes.
Can you talk a little bit about that, Anna?
Yep. So all of our providers go to what is called Right Start Live. It is a program put on by Healogics. So what they do is they go to that for a week. They learned all about different types of wounds, how we treat wounds, what are the clinical practice guidelines, and how can we achieve the best. So they do that for a week. They do take a test at the end of it, and then they are competencied in that.
Yeah. So these folks are the medical staff that are, and your team gets the same kind of training
Yes.
that have done that. So everybody's on the same page in terms of how you go about taking care of whatever kind of wound comes your way there in the center.
Yeah, correct.
Which is really key in terms of the outcomes that you all are getting, I would think.
Yes.
Yeah. Okay. So you alluded to this earlier, Anna. We were talking about the hyperbaric oxygen and that it got down to the level of the capillaries. But one of the key concepts in wound healing is you need blood flow for a wound to heal up.
Yep.
If you don't have blood flow, not going to be good.
Nope, not so good.
Yeah. So how do you, sometimes people need a little more help than the wound center can give them.
Yep.
And basically you need vascular surgery of some type or to open up some blood vessels. Can you guys talk about how you coordinate that with Dr. King, who's our vascular surgeon, and his team?
So we work with Dr. King and Erica very closely. She would be the nurse practitioner in vascular also. We have communication with them daily. We know from research that certain populations are at risk for blockages in their arms and legs, and that can stall their wound healing, like you alluded to.
Yeah.
We do screenings at the wound center to try and determine, if patients have enough blood flow to those areas in their wounds. And if they don't, we send them to Dr. King and Erica because they have more expertise than we do in that.
Yeah. Yeah. So that's good for folks to know as well, I think. Another thing I'm just curious about. So what percentage of your patients come referred from their physicians versus come on their own to the wound center?
So I don't know the exact percentage, but it is a very high number are referred to us. We don't require a referral. So we have quite a few patients that come themselves. And I think that's one of the most important things. A lot of times people think, well, I have to have a referral to go there. No, you don't. You don't have to have a referral. But if your doctor does see a wound, it is pretty common that they will reach out to us and set up an appointment for you.
Yeah. So that's one of the things I would want folks just to kind of key in on is that, most of the time your own doc is going to see that wound and send you there. If you have something though that, like we were talking, like you've had radiation damage and your bladder's bothering you, or you constantly have bloody diarrhea or those kind of things, you can just go to the wound center and they will evaluate you. They have their physicians, medical staff, and nursing staff who will begin that process and try to get you healed up.
Yep.
So, okay. Hey, what's your background in, Anna?
So my background is actually in agriculture business.
Well, there you go. We have a lot of farmers around here.
So, but I will say, I grew up watching my mom be a nurse, and I was very interested in the hospital from a pretty, about a college level. Once I got through college, I thought, I kind of want to get into that. So I started in the billing department. I worked on patient accounts as an insurance coordinator, and then I moved to supervising the business services department. And then this position came open, and I took this.
Yeah. Okay. I knew you were business. I didn't remember ag business.
Yep.
Well, that makes sense from coming from a farm kind of background. So, so coming from that background, what has surprised you most about the wound center as you've gotten more involved in it in the last couple of years?
So I guess the biggest things that surprised me was the diversity of the wounds. Jumping into it, I kind of thought it would just be a lot of diabetic wounds or a certain age group of people, and it's not. We have little kids come in that, their little brother pushed them on the treadmill or, anything you can think of. So really, it's just been a very interesting position because no day is ever the same.
That's a good day. I mean, that sounds nice.
It is.
Yeah. Anna, it's been great having you and chatting with you. And I definitely learned some things kind of chatting with you today. I hope I trust and know our viewers did as well. So thank you. And yeah, we're putting up some stuff here about if you have some questions, that's how you reach out.
Yep.
What we're going to do now is Anna and I we're going to bug out, and you're going to see us again, but we're going to see us at the wound center doing a short little field trip. And we're going to show you some interesting stuff there at the wound center that, if you weren't there, you wouldn't know about. So, this looks like it's going to be it. We did this yesterday, so you'll get the chance to see us walking through the center. Hey, for those of you who listen, as always, thank you so much for being part of this broadcast and listening, and thank you for your questions. And I'll be back next week, and we'll talk some more. Until then, thank you, and enjoy the field trip.
Thanks, everybody.
Hey, hi, this is Bill. Anna, you just saw us on Facebook Live with our interview, and now we are going back in time to Wednesday, and we're here in the wound center doing a little field trip for you. So looking forward. It won't take real long. It's not a real big department, but there's a lot of interesting stuff going on here. Wouldn't you say, Anna?
Yes, very much so.
Okay, before we do the trip, I've got a few folks I want to introduce to you. Hey, Terry. She's not there. Okay. Nope. Oh, never mind. Hey, come here, Peg. Come here, Jeannie. So we have a small enough staff here. I just thought I'd introduce them to you. So this is Jeannie. Hi, Jeannie.
Hi, how are you?
Jeannie, how long have you worked here?
About 13 years.
Okay. Peg?
4 years.
Okay. Now, how long have you worked in wound, though?
At 20 years.
Okay. 13, 20. Okay, I'm doing the math on this. How much experience we have. How long has Terry been here?
Make me show my age. 13 years.
13 years.
Been here since the beginning.
Okay, we're at 46 years of experience here. And then I'm going to introduce you to some other folks in a second. Anyhow, I just wanted to introduce some of the nurses. When you come here, staff here knows wounds inside and out because they've been doing it for, they're very experienced, right? Not old, experienced. All right. Thanks, ladies. Good to chat with you. Okay, so Anna, what do you think we should go take a look at here in the department? What?
I think HBO would be a very interesting thing, which is our hyperbaric oxygen therapy.
Let's do it. Okay, so let's roll this thing here, Liz, and we're going to go and take a look at HBO. Come along. Hi.
Hello.
How long you worked here?
Since we opened in January of 2008.
I'm doing the math on that. 13 years. That seems to be a theme here. 13 years for people that like Jeannie's, that's when the department started. That's how long she's been here?
Just about. She came in shortly after we opened up.
Okay.
Yeah.
All right.
Very experienced staff.
Yeah, for sure. So, okay, this is for most folks in the general public, you just wouldn't know that this is here, but it is. It's called hyperbaric oxygen. And in kind of a nutshell, explain the science behind it for the folks who are listening, Kathy.
Basically, in a nutshell, when you go into the chamber and you're pressurized with 100% oxygen, you're breathing in the oxygen, it gets into your bloodstream, and it's kind of like a healing from within process.
Okay.
Nutshell.
Okay. So that 100% oxygen with pressure, there's something about that that helps those tissues that are damaged to get better way quicker than they would otherwise.
Yes, yeah, it's a good adjunctive therapy with good wound care, good debridement, with the patient being compliant with their care. Also,
Yeah.
this really helps speed up the healing process.
Yeah. Yeah, for sure. And the other thing I was just curious about with this, before we take a look at the chamber itself, some people just think in terms of a wound as like the only thing that this would do would be like if you have a sore on your foot, like a diabetic kind of wound or something like that. I'm pretty sure you can do more than that kind of stuff for this. Can you kind of speak to that?
Yeah, we do a lot of wound care with this. Actually, as you mentioned, the diabetic wound care. We can help with radiation burns, with osteoradionecrosis.
What's that?
That would be
Like your
infection
jaw
in the bone. Yeah.
Yeah, so
in
you've
the
had
jaw.
some sort of radiation to your jaw, and
Yes.
it's affected the bone in your jaw.
That's correct.
Yeah.
Yeah. We see a lot of that with dental patients
Okay.
that have issues after they've had radiation somewhere around there.
Okay.
We can help with soft tissue radionecrosis. We see patients, especially gentlemen with radiation cystitis.
Yeah.
We do a lot of good with that kind of a process. Also.
So that's going to be your bladder's irritated because of radiation. Usually prostate.
Yes.
Yeah. Right.
Yes.
So-
Usually that's
okay.
where we would get the patients from. We do
Lots of crush injuries.
crush injury. Yeah,
Okay.
we've done some good care with crush
Okay.
injury patients. We've helped them out a lot.
And then I think that radiation beam not only gets your bladder, it gets your kind of your rectal area too. So you do a little bit of radiation, what we call proctitis work too.
We've treated some patients with that also.
Yeah.
There's a few other indications that we can treat also, like
Failed grafts and flaps.
that's a good one. Yeah.
Mhm.
We see a lot of, if a patient were to go and have surgery and then they have a flap done,
Yeah.
where they bring the skin over.
Yeah.
And if that starts to fail at any time, we can get the patient right into the chamber, and that's a good help for them also.
Okay. You don't have any athletes that show up so they can have better performance on the.
No, not an indication we treat.
Okay, just asking. You hear about these big time athletes that have these tents
Right,
that they sleep
right.
in and stuff like that. So, okay, let's look at one of these things. Walk us through this, Kathy.
So this is our chamber. The
I'm gonna
patient
get on this side of
Sure.
you so you can kind of.
the patient would come in. I would set him up on the bed. We do a full set of vitals on a patient prior to them going into the chamber. The doctor would come in. They would listen to their lungs, make sure everything is clear there, check their ears, make sure they don't have any problems there. The patient needs to be able to clear their ears from the pressure inside the chamber. So once the doctor does that and they give me the okay, I would slide the patient into the chamber, shut the door, turn the chamber on. At that time, it starts to pressurize. I would set the chamber to the pressure that the doctor's written for that patient. Once they reach their depth, a 90-minute timer starts. Once their 90 minutes is done, we start a decompression on the patient.
Okay.
When the decompression is done and all the pressure is out of the chamber, I'll open up the door. I bring the patient back out, recheck their vitals. Once everything is good there, the patient goes in, they get dressed, they come back the next day and do it again.
Okay, what's that? Rinse, cycle, repeat. So 90 minutes is a long time to hang out and sitting in a chamber. Is there any way that you have for folks to have a little bit of entertainment?
Yeah, they can watch TV. They can bring in movies. Our TVs are equipped with DVD players, so
Okay.
they can have that. They can take a nap. They can sleep if they want to. I always tell them it's a good time to get that nap in for the day. So they
Okay.
have about 2 hours that they can do that.
All right. Do you have any favorite movies that folks tend to watch? Any genres that folks, are they rom-com people, or are they going to do action adventure? Classic movies?
I actually see a lot of gentlemen who want to do country western.
There you go.
Mhm.
All right, John Wayne kind of stuff.
I have a very good collection of John Wayne movies for them.
Okay, that gives you some sense of our clientele too here.
Yes.
So, Hey, Kathy, good chat. Anything else that you'd point out that I forgot to ask you about?
No.
Okay. All right.
I don't
Okay.
think so.
All right. Well, hey, if you all need this, I hope you don't, but some people will in our community. Kathy's been at this for 13 years, knows it inside and out, and you're in good hands if you do need to have hyperbaric oxygen under
Thank you.
Kathy's care. So thanks, Kathy.
Thank you.
Hey, I have Jennifer with us now. Hi, Jennifer.
Hi, Dr. Bird. Hi, everybody.
Jennifer, what's your title here? I lose track of different titles and stuff.
I am the clinical coordinator of the Wound Center.
All right. I'm going to call her like the nurse in charge. How's that sound too?
Sounds fine.
Okay. I thought when we kind of did the wound center stuff, first of all, and by the way, Jen does other stuff too. She's here, but I just saw her probably half an hour ago over at the hospital. Can you kind of talk about how the wound center helps out with the hospital and how you're part of that?
Okay, so we also go and round in the hospital on wounded patients, whether there are patients or patients that come into the hospital that have existing wounds or have a non-healing incision or a troubled incision from a surgery. I actually just went over and placed 2 installation wound vacs, which is a fancy car wash vacuum cleaner for 2 abdominal incisions that we're having some trouble with. So it's great therapy. It's great to be to get over at the hospital and help patients over there and then be able to transition them over here and heal them out.
I wanted Jennifer also, though, to kind of talk a little bit about some of these biological scans for what's the fancy word that you guys use?
So this is a cellular tissue-based product. Some of them are bovine in origin. We also have here 2 that are placental in origin. There are some that are from the umbilical cord. So yes, these come from C-section deliveries. They take part of the lining of the uterus or I'm sorry, the placenta, part of the lining of the placenta and part of the umbilical cord and make sure that it's sterilized and it goes through the processing. And then it has healing properties. We think of stem cell research. It kind of goes all together. So these help stimulate wounds to heal. If a wound has been in place for 4 weeks or longer and under treatment, and they just need a little boost to help them out. So this helps heal the wound by giving the jump start.
Okay. And so if you had like we do the normal stuff, not normal, but we do like our traditional wound healing here first. And if that's not working so well, sometimes that's a direction that people go.
So we do a couple different things. We do debridement, which is actually this machine right behind Dr. Bird.
Which we'll talk about in just a minute here.
And we do debridement, specialty dressings. We follow our patients weekly because wounds change very quickly. They're like our kids. They grow up fast. So, and then we also have a few other modalities that we can use. The hyperbarics that you just saw. We have total contact casting, compression wraps, or the cellular tissue-based products to help heal wounds.
If you put one of these, if you were to put one of these on me, if I had a wound, like how often would you have to change it, or does it just stay on there for a long time?
Most of them we change weekly. So the cellular tissue-based products we typically change weekly. If you go to OR and have a split thickness skin graft, which is just taking off the top few layers of your skin, then that's a one and done, and we just watch it and make sure that it heals appropriately.
Okay. Yeah, this is really fascinating stuff. Was this available when we started the Wound Center 13 years ago?
There were forms of it available. Compared to what we have now, they were very primitive.
Okay. All right. Yeah, I've heard this can be really helpful for patients do you do this and the HBO at the same time? Or are they separate things that you do?
No, we have a cellular tissue, these are our clinical practice guidelines. This is kind of our A to Z of wound care, but it's not a linear process. It kind of all happens all at once most times.
Yeah, good. And we talked about wound vacs. Thanks, Anna.
Yep.
So yeah, I know I don't want to have you to break something that you can't put back in there, but just give us a general of this wound vac and how that thing works if you can, Jennifer.
So this is one of our smaller versions of the wound vac. This is a disposable wound vac for wounds that are low exudating or patients that can't tolerate a traditional wound vac. It comes with a small dressing, and then this is actually a spring-based system my Vanna.
That's
This
right.
is actually a spring-based system that we pull this plunger out, and then once we hook it up to the tubing, we push the plunger down. It seals it. As you can
Okay.
see, I can take the plunger out now, and it
Yeah.
seals it, and that's what that spring inside of there is what provides the suction
Sure.
that helps force our wound to heal.
So rather than a giant sucking sound, it's a slow sucking sound over time that kind of just keeps that pressure off of the wound. Is
Yeah.
that what we're doing?
There shouldn't be a sound to it. It should be silent.
Being facetious, but anyhow, yes.
It should be silent, but what it does is it pulls your wound edges together. It pulls the cells and stretches them to divide.
Yeah.
It helps promote blood flow to that
So
area.
if you're adding a little bit of like almost traction
Mhm.
to that
Exactly.
skin, you're over time going to help that to heal better.
Exactly.
Okay. Very interesting stuff. Very interesting stuff. Jennifer, thank you for kind of going through this with me. And in just a minute, I'm going to bring in one of our nurse practitioners who's going to talk a little bit about this thing to my right. Hey, I'm back and I have Teresa Kruger with me. Hi, Teresa.
Hi there. How are you?
Well, I'm doing just fine, thanks. So Teresa's a nurse practitioner here at the wound clinic and she's been here a few years. How long have you been here?
Around 3.5 years.
Okay. All right. So yeah, she's a relative rookie compared to the rest of the folks around here, it seems like. But anyhow, yeah, Teresa's been here for 3.5 years. I wanted Teresa to show us a little bit about this machine that when I was talking with Jennifer that I pointed out to you. It's called a Masonics. Is that right?
Yes, this
Okay.
is the Masonics, one of the great tools that we have to keep wounds clean.
All right. Well, tell me a little bit about how it works and how you go about that for patients.
So the Masonics uses ultrasound waves, and it's a low frequency, so it reduces pain for us to clean wounds, and it also uses water to help clean the wounds, similar to a jet that you would use to clean your teeth.
Okay.
So it cleans the wound and it reduces the pain while we're doing that.
Okay. All right. So I'm looking at that. Can you pick that up for me?
Sure.
So I know it's hard for the folks to see, but if you'd point it straight at the camera, what's that tip? Is that where there's this little bitty hole here? Is
Yeah,
that
there's
where it's
a little
coming out of?
hole and the water would be coming out of that. It's not hot and it's not cold. Most patients find it very soothing, and we like it because it gets the wound so clean and reduces infection.
So if your wound is cleaner, does that make it heal better?
Oh yes, this helps us heal wounds a lot faster. One of the many tools that we have.
Okay. So in other words, it doesn't hurt them when they have that done to them?
No, generally there isn't very mild pain, but we often help people with the mild pain by numbing the area first
Okay. That's
with
what I was
just a
wondering.
little topical ointment.
Okay.
So we put that on the wound. There's no needles, just topical ointment, and that numbs the area, and then this gently cleans the area.
Yeah. Does your typical patient get that, or is it just a special type of patient that's going to have this Masonics?
Not necessarily special. It just is determined if we feel like the patient's wound would benefit from this. So we do use it often.
Yeah. Okay.
Yep.
All right, good. Anything else about this thing that I didn't ask you that you'd want to let people know about?
No, I think that if any patient comes in here, they're going to be very impressed with the selection that we have to help them heal their wounds fast without any pain.
Okay, good. Hey, Teresa, I know you're between patients. Thanks for stopping in and chatting with me. I appreciate it.
Thank you.
Okay. Hello again, Jennifer.
Hi, Dr. Bird. Hi, everybody again.
We're on the other part of the room here. One of the things that we were talking about that I thought might be good for folks to see too are some of these specialty boots that you use here at the clinic to help folks heal their wounds. Can you give us a little bit of an overview of those, Jennifer?
Yep. So we have a variety of what we call offloading devices. This one is just a simple post-op shoe. We take the inserts out underneath of the insole to help take the pressure off of the area if you have a wound on the bottom of your foot or even the side of your foot. This one is called a total contact cast. This one's a little bit more secure. So you would come in once a week and have this changed. It's a multi-layer dressing. So we put the dressing on your wound first. We put padding on your leg, and then we put this fiberglass cast on
Can I
there.
feel that?
Mhm.
Oh yeah, that's nice and firm.
And of course, this one's already cut because we use it for training purposes and for demonstration like this. But this goes on your leg and it would stay for a week at a time. What it does is it transitions the pressure that your foot feels, whether you have sensation or not. onto your calf. So your weight is being held by your calf instead of being put on that area of your wound, whether it's on,
and offloading that helps to heal the wound.
yep, taking that pressure off.
Okay.
To further take the pressure off from that and to make sure that our cast doesn't crack, we put it in this walking boot. It has a little bit of tread on the bottom so that in icy weather like this, you don't fall down, because we don't want that. And it secures the boot, the fiberglass cast right in there to further take the pressure off of that wound so that we can get you healed. This is the gold standard. Typically 95% of patients that have a total contact cast heal within 6 weeks.
Really?
Mm-hmm.
So most patients, what percentage of patients would you say just go this route rather than some of the skin stuff that we talked about in the HBO?
That's a tricky question, because
that's why I asked it.
That's like I said earlier, this isn't a linear process. We don't start one and then do the next and then we do the next part. We kind of hit everybody with our different modalities all at once. We hit you from all sides. So we're debriding the wound. We're using special dressings. We're putting you in a total contact cast. We're making sure that you have enough blood flow to that area, and partnering with people like Dr. King and Erica over in the vascular office, and utilizing wound vacs and cellular tissue-based products all at once. Because
Well, let me phrase it. Let me phrase it this way then. Of the folks that you have that are here that get all these multimodality things done, what percentage of them would you say a part of that treatment involves this boot process?
We probably put about 5% of our patients in there in a total contact cast.
Okay. All right. Since we're on a percentage roll, what percent of their modalities have that skin? Would you say?
It varies from time to time, but I would say probably a good 40% of our patients will get them at some point.
Okay. How about the HBO?
HBO is about 10% of our patients are eligible.
Okay. All right. Yeah, I just wanted some folks to get a sense of what we use when and all that type of stuff. So good. All right. Hey, Jennifer, thanks. I that's really good to see that and kind of get a sense for what that looks like. And every week they're getting that changed out if they're using that.
Yep. Yep. And it just, like I said, it takes that pressure off and helps us heal that wound faster.
Thank you, ma'am. Appreciate it.
Thank you, Dr. Bird. Thanks, everybody.
We're back.
We're back.
Anna and I are back. We started it and we're going to wrap things up together here at the Wound Center. As you've kind of watched your folks kind of talk about the things that they do, it's pretty impressive.
It is very impressive.
Yeah. I mean, and how long you've been overseeing them?
I have been at the Wound Center for 2 years.
Okay. All right. Yeah. I'm thinking that in those 2 years, you've seen and done things that you just didn't think.
Would never have guessed in a million years. But it's been a very rewarding position.
Yeah, I'll bet. Because I may have asked you this again tomorrow, but I'm going to ask you just today for those who are just watching the field trip. It's a pretty high percentage of folks who have wounds that get those healed by the time they're done with the Wound Center here.
Yes, that's correct. It's usually between 75 and 80% is our comprehensive healing rate.
Okay, which is, for some of these complicated wounds, you think, 100%. But for some of the wounds that you all see, that's really good.
Yes,
and I at least the last I looked at your data compared to other centers like this across the country, I think we do pretty well here.
We do very well. We have had the Center of Distinction Award for multiple years.
Okay. All right. Center Distinction is code for they do a really good job.
That is correct.
Yeah. Okay, good. Anna, looking forward to our conversation tomorrow. Thank you for showing off your folks here. You have a great team, and I hope the folks who have been watching us have enjoyed kind of seeing what we do here at the Wound Center. Hope you don't ever need it, but just know it's here to help you if in fact you or one of your loved ones needs some help.
Right, and we don't require referrals.
Okay, there you go. That's good to know too. Thanks everybody for watching, and thanks.
Thank you very much.
You're welcome.